When we think of men's mental health, we're likely to think of men as being one homogenous group. However, there are so many different types of men, and one of those groups, one of those types of men is older men. But how do older men experience difficulties with mental health, and how open are they to accessing therapeutic treatment? What's up guys, welcome to another week's episode of GetPsyched, and today we're doing a continuation on from our men's mental health series, and today we're going to be taking a look at older men's mental health. Now, older men's mental health is actually the specific area of the research that I'm conducting. I'm doing my research project during my doctorate in counselling psychology on men's mental health, and I'm specifically looking at older men. So the first question that you might be asking, much like other questions that we've asked in previous videos in this series, is what is the issue in the first place? Well, statistically speaking, and the research says that older men are actually the most at-risk group of suicide due to mental health difficulties in the UK. The combination of their sex and their age mean that older men really do experience extreme difficulties at times with their mental health. And what's more concerning is that there's actually really limited research in this area regarding mental health of older men. We still have a huge way to go in fully understanding what the difficulties are with mental health in older men and why they're there. So what is so specific about mental health in older men? Now don't get me wrong, older men experience difficulties with their mental health due to factors that are attributable to all men. Last week we looked at the mental health of boys, and that was the same there. There's plenty of factors and contributing factors to mental health difficulties with boys that are applicable to all men, and the same goes for older men. However, there are some issues that are specific to older men that are applicable to this demographic only and really don't apply to men in general or even younger men. For example, the inevitable increases or the increasing influence of medicalization and medical treatment that inevitably happens in older age. Research has shown that increased exposure to medical treatment, hospital stays, increases in medication can actually have increases in depressive symptoms. So the fact that this group, this older men group, are in their older years, it's more likely that they're going to experience medical treatment, and as a result, it's more likely that they're going to experience mental health difficulties as a result. Also, similar research has shown that with difficulties and impairments in physical abilities, once there starts to become physical limitations into older age, we can also start to see correlations to depressive symptoms. So that means that's people as a whole, not just men, but as people become older and physical limitations start to increase, we as a result inevitably see increases in depressive patterns. So my point here is that there's actually something about this demographic with regards to getting older that's going to result in inevitable issues with depression and mental health issues. Now, like I said, both of these things are actually applicable to older women as well, but what is it then specifically about older men that make these issues really challenging for mental health? Well, in my own opinion, and in the research I've done, it actually comes down to a lot of the fact that there are two main components here. That this group are older and that they're men. Older men, of course, just like older women, have to experience challenges with physical limitations and increases in medicalized treatments, which, as we've said, can have implications for depressive symptoms. But that's not the full story for older men. They still have to adhere, or sometimes they socially constructed, so to speak, they still feel that they have to adhere to hegemonic, toxic, masculine principles. Now, if we go back to the first video in the men's mental health series that we've done with GetPsyched, I talked a lot about male identity and masculinity and how I feel that male identity is the biggest factor that contributes to mental health difficulties amongst men. And I think that's absolutely applicable to older men as well. The challenges that older men have with their male identity and the socially constructed aspect of masculinity, and how that has an influence on their mental health when they start experiencing physical limitations, the fact that they need to start asking for help, the fact that they need to increase medical treatments. How does that collaborate with their male identity, with their masculine male identity? The two simply don't line up. Being autonomous, being physically and emotionally strong, not asking for help, those are the kind of things that just aren't always available for older men. But they are the kind of things that we demand as a society and that men demand of themselves that they adhere to. And that doesn't change as men get older. Those male identity principles, those masculine principles don't go away. And as a result, we can experience severe complications with older men's mental health. Now, there's a huge lack, like I said earlier, there's a huge lack of research to do with the combination of being old and the sex of the individual. In this case, it's older men. But that's not only the case in research, also in the psychological literature itself, there's still a profound lacking understanding of the specific implications and the specific issues that older men face with regards to their mental health. For example, recently the American Psychological Association published guidelines on how to deal with the mental health and work with the mental health of boys and men. However, they did not go into any real detail about dealing with the mental health complications and working with mental health in older men. I'm actually going to put a link down in the description to this video, and if you're listening on the podcast, you'll get this on the show notes. I'm going to put a link to the PDF where the APA published those guidelines on working with men and boys with mental health difficulties. In addition to this, a few years earlier, the American Psychological Association did actually publish guidelines on working with older people and mental health, working with mental health complications amongst the older population. But once again, they did very, very little to address the specificity of older men as this identifiable group. So even in the psychological literature itself, even in the guidelines that psychologists and therapists utilize, there is not much of a consideration for this demographic. So what is the result of all of this? Well, some of the research that is out there about older men's mental health says that there is a degendering of older men in society. Now, this is where we no longer really consider older men as having a male identity. Rather, they're grouped in the older people identity, the older people demographic amongst women and men, for example. However, even though those older men are within that older men demographic, like I said earlier, they're still adhering to hegemonic masculine principles. And I'm talking stereotypically, I'm talking very generally here for the purposes of this video. But I think you can get to grips with what I'm saying and the complications that this kind of thing can cause for the mental health of older men. Now, you combine this degendering effect of older men with the fact that there are profoundly fewer older men than older women in the UK today. Likewise, the population of care institutions, nursing homes is primarily actually surrounded around women. The majority of employees within these sectors are female. Now, the reason I discuss this, the reason I bring that up, is that you can start to see that older men not only are not given their male identity, but they're also further isolated. There are fewer older men than older women, and the areas such as care homes and helping services, health services, are actually primarily made up of women. You can start to get the sense that older men become more and more isolated. And I really do believe that all of this contributes to challenges with the mental health of older men. Okay guys, thanks so much for watching this week's episode of GetPsyched. We've done a little continuation today on our men's mental health series, and today we've taken a look at older men's mental health. If you've been enjoying this series, you'll be able to check the playlist out below me on the YouTube channel and GetPsyched. And if you've been enjoying GetPsyched as a whole, then make sure to comment and like on our videos. You can also subscribe, and you can hit that little bell next to the subscribe button and get weekly reminders every time I upload on Mondays. Again guys, thanks so much for watching, and hopefully catch you next week.